Today we'll discuss about the dentinal hypersensitivity. So we'll see the definition of it. It is characterized by the short, sharp pain arising from the exposed dentin in response to the stimuli, typically thermal, evaporative, tactile, osmotic, or chemical, which cannot be ascribed to any other form of the dental defect or the pathology. If you see the etiology, it is maybe due to the enamel loss, due to the wasting diseases such as the attrition, abrasion, erosion, or effraction. Or it may be either due to the parafunctional habits, that may be the bruxism or any other toothbrushing habits. If you see the cemental loss can occur due to the gingival recession or due to the periodontal diseases such as periodontitis or by the root planing procedures. Or it may also occur due to periodontal surgeries. If we'll see the development of the dentinal hypersensitivity, it occurs in the two phases. That is a lesion localization that requires the exposure of the dentin by the gingival recession, abrasion, erosion, or by the lesion initiation, which requires the removal of the cementum or the smear layers, which occurs due to the periodontal procedures or by the erosive agents. Now we'll see the mechanism of pain transmission theories of the dentinal hypersensitivity. First theory is the direct innervation theory, and this is the first theory which was put forth to explain the hypersensitivity. Here, the nerve fibers present within the dentinal tubules will initiate the impulses when they are injured, and this causes dentinal hypersensitivity. But according to this theory, there were few disputes that raised that when pain-inducing substances like potassium chloride are applied to exposed dentin, they fail to elicit the painful response. Due to these shortcomings, this theory is no longer accepted. Next theory we will see is the odontoblastic deformation theory. This theory suggests that the odontoblast or their processes are damaged when the external stimuli are applied to the exposed dentin. So as a result of this, they conduct the impulses to the nerves in the predentin and underlying pulp, from where they proceed to the central nervous system. Okay, but this also has some drawbacks, such as odontoblastic membrane potential is too low to permit the transduction. Another valid finding is that no demonstrable neurotransmitters like acetylcholine in the neural transmission of the pulp occur. So that's the reason it is no longer valid. Next theory we'll see is the hydrodynamic theory, which was proposed by the Brainstorm, and it is the most accepted theory because structurally the dentin has 30,000 dentinal tubules per mm cube, and they are filled with the dentinal tubule. Okay, fine. Then in a vital tooth, there is a constant slow outward movement of this fluid through the dentinal tubule. So this theory states that whenever the exposed dentin is stimulated by the tactile, chemical, thermal, or the osmotic stimuli, there is a rapid movement of the dentinal fluid either towards the pulp or outward, which causes the direct stimulation of the low threshold A delta nerve fibers in the pulp, or the indirect stimulation of the A delta nerve fibers in the pulp by displacing the odontoblastic cell bodies. Okay, that's the reason it is the most accepted theory representing the hypersensitivity. Now we will see the clinical features. First and foremost is the pain. That is a short, sharp pain in response to the heat, cold, tactile stimuli, sweet or sourful, which is an exaggerated response of the normal pulp-dentin complex that is felt on application of the external stimuli. And there is no lingering type of pain there is no lingering type of discomfort once the stimulus is removed. That's the reason we can say that the dentinal hypersensitivity is almost similar to the acute irreversible pulpitis, and we can also write the diagnosis as an acute irreversible pulpitis for the dentinal hypersensitivity. Okay, and we'll see the clinical features, that is if we have this sore, cold, tactile sore stimulus, it gives an exaggerated response to the normal pulp-dentin complex. That's how this too cold, sore food or the hot food act on the teeth. Okay, coming to the diagnosis. So, when the patient says with the symptoms of the dentinal hypersensitivity, first is to diagnose by taking the case history, and later on we can go for the clinical examination. Okay, in the clinical examination, the tactile examination can be done with an dental explorer. Okay, and whereas the thermal examination will be done by the air blast, and other tests such as the radiographic test and the signs of the fracture and leaky poor restorative margins can be chosen. Okay, now the differential diagnosis of the dentinal hypersensitivity is more difficult when there are other conditions causing reversible pulpitis in combination with the exposed pump are seen. So we can go with the first differential diagnosis is through check it, that is the fracture restoration or the fractured enamel or the exposed dentin or the dental caries or the post restoration sensitivity or the cracked tooth syndrome or the bleaching sensitivity. So management of these conditions is different from the treatment of the dentinal hypersensitivity. Now we'll see the prevention of the dentinal hypersensitivity. And for the patients who are suffering from the dentinal hypersensitivity can produce the valuable advice to prevent and reduce the clinical symptoms. And this can be done by with the help of the diet counseling or with the help of correction of the brushing techniques or care during the operative procedures or by taking the care during the periodontal procedures. After prevention or prevention is just like a better to prevent rather than to cure. Now we'll see the cure, that is the management of the dentinal hypersensitivity can occur by the desensitization of the dentinal tubules or by desensitization of the by blocking the pulpal sensory nerves. Okay, the desensitization of the dentinal tubules can occur by formation of the smear layer or by the use of the topical agents to occlude the exposed dentin or by the placement of the restorations or by the use of the lasers. These all will occlude the dentinal tubules, thereby causing the desensitization. Next step would be the desensitization by blocking the pulpal sensory nerves. This can occur by the potassium nitrate paste or by use of the other agents. First one we'll see in this the formation of the smear layer over the exposed dentin. This can be done by burnishing the dentin dry for a few minutes with an orange wood stick, which results in the formation of the smear layer and partially occludes the dentinal tubules by giving the temporary relief from the dentinal hypersensitivity. Next is the use of the topical agents. In this, we can use the calcium hydroxide powder to form the thick paste and placed on the exposed dentin, and this increases the remineralization of the exposed dentin, thus reducing the dentinal permeability. Other method can be the use of the calcium phosphate paste, that is the application of the ACP or CPP paste, that is GC tooth mouse, will help in increasing the remineralization of the incipient enamel caries. Next, we can see the silver nitrate. Here, the application of the silver nitrate solution over the exposed dentin will reduce the fluid movement by precipitating the protein or the silver chloride within the dentinal tubules. However, this is not so popular nowadays because it will stain the dentin and may cause damage to the pulp and the gingiva. Next, we'll see the strontium chloride. It is incorporated in the desensitizing paste, which acts by penetrating the tubules and forming the strontium apatite, which is dentinal tubules. And next, use of the sodium fluoride or by the application of on the tooth for few minutes will form the fluorapatite with the tubules and causing the blocking of the fluid movement. Next recent is the fluoride iontophoresis. Here, in this procedure, the ions of the chosen medicament are driven into the specific tissues by means of the electric current. So, the fluoride iontophoresis will transfer the fluoride ions into the dentin, thereby causing the desensitization by the formation of the fluorapatite. And it also gives the long-term relief from the dentinal hypersensitivity. Next, we will see the application of the potassium oxalate solution. This helps in blocking the dentinal tubules and preventing the fluid movement. Next is the dentinal adhesives. The use of the dentin bonding agents to treat the dentinal hypersensitivity will seal the exposed dentin by micromechanically bonding to it through the formation of an interdiffusion hybrid layer. The agents include the Gluma desensitizer, amalgabond, or the single bond. Next is the placement of the restoration. Whenever a considerable amount of the dentin is lost, it becomes necessary to replace the missing tooth structure. So, in such situations, the GIC or the composite resin may be placed over the lost tooth structure to seal the exposed dentin, which provides the long-lasting relief to the dentinal hypersensitivity. Next, we can use the lasers. The hard tissue lasers such as the carbon dioxide Nd:YAG or the erbium YAG laser helps to treat the dentinal hypersensitivity by blocking the depolarization of the A delta and the C fibers. Next mechanism we'll see is that the desensitization by blocking the pulpal sensory nerves. This mechanism helps in treating the hypersensitivity by reducing the excitability of the sensory nerves in the pulp in response to the various stimuli. In that, we have the various toothpaste in which the potassium nitrate solution is incorporated, which will block the depolarization of the sensory nerve endings close to the odontoblast, which will prevent the transmission of the impulses to the brain, thereby reducing the dentinal hypersensitivity. In recent years, we have this use of this bioactive glass which has present in the Novamine and the Biomine toothpaste, which will infiltrate into the dentinal tubules, thereby desensitizing the pulp sensory nerves. Now we'll see few recommended treatment approaches for the dentinal hypersensitivity. In case of the few teeth are affected, that is isolated cases, in such cases we can apply the varnish dental adhesives or the adhesive resins or the adhesive restorations also. Or if in case of the generalized hypersensitivity, we prescribe the dentin desensitizing toothpaste and the mouth rinses. Whereas in case of the severe hypersensitivity, we usually consider the endodontic therapy. So this is brief about the dentinal hypersensitivity.